insurances view it as still experimental, even though it's been on the market for 20 years, and they don't cover it. Okay, they don't cover PRP. They don't cover stem cell of any kind. They don't cover amniotics or any of those things. So what's our dilemma? So first of all, it's, when it first came out, it's only for those that can afford. But some people, when they look at everything in its entirety, say, look, I have a deductible, it's X amount of money.
Right.
All right. And even if I have a surgery, I'm going to still pay X amount, and there's complications involved. There's time off work. There's going under anesthesia and all those things to get people angst. And some people will say, look, if I get 75 to 80% improvement, then I'll pay $2,500 because I would have to pay that on my deductible anyway.
Anything to get out of pain.
That's right.
Just lightning in the bottle.
Exactly. Yeah, and so the whole time off work, all those things are mitigated with this. It's no real time down.
Hi, and welcome to Leadership Unlocked. I'm George Lockhart, your host, and I am so proud today to be talking with several of the leaders from Palm Beach County. Today, we have Dr. Brian E. Coleman. He is from Indianapolis. He's been practicing for over 30 years, in foot and ankle and hip, and we like to call him snap, crackle, and pop. Anything that happens, he can fix it. Now, he went to Dayton, then he went to Indiana University, then he went to Howard, then Baylor. So he's very well accomplished, and he's the president of the T. Leroy Jefferson Foundation. Thomas Leroy Jefferson was the first Black doctor in Palm Beach County, and we're going way back in the 20s, and he would go and do house visits on his bicycle. So it's very important that for this first show that I have this guest on. As a former athlete myself, I think it's important that the cutting edge things that he's doing is going to really help people. And he himself, I can't wait to read his autobiography and some of the books that he's going to come out with, the how can we fix ourselves as far as self-healing is concerned. So help me in welcoming my friend, Dr. Brian Coleman.
Hey, buddy. How are you?
Good. How you doing?
Great seeing you.
Oh, man. Pleasure's mine. We have a picture of Jackie Robinson here, one of my heroes here on the set. And it's a lot of things that he went through without having all of the technology today. How in the world? Or you take a look at Gale Sayers, right? Had a knee injury that was career ending, and he could have been back in 6 weeks. Things of that nature. So, tell us a little bit about yourself and what's going on in your world.
Well, Dr. Lockhart, first of all, I appreciate the opportunity to be on the show. The evolution of healthcare, particularly in the musculoskeletal orthopedic field, is really amazing. As you alluded to, Gale Sayers, who would happen to be one of my favorite players of all time, had tore his ACL. And back then, that was a career-ending injury. He tried to make a comeback, but was only a shell of himself. So, we've come a long way. Now ACLs, for example, are very commonplace, and players can actually go back to running within 4 to 6 months and at least be at 80 to 90% competitively the next season, when before it was questionable as to whether they would return at all.
Competitively at the professional level?
Absolutely.
Wow.
Absolutely. There's various examples. I mean, you in any professional sport, but particularly in basketball, football, ACL injuries happen all the time, at least 2, 3, 4 times a month that we know about. And that's on the professional level. So it's really one of the most common sports injuries that has probably progressed the most.
I saw a staggering statistic that said that women athletes have more ACL injuries or knee injuries than men. Why?
Well, it has something to do with genetics, their body habitus, the alignment at the knee, foot, ankle level is a little different than males, which make them a little more prone to those type of injuries, particularly ACLs.
I think that the obvious question is, should they be playing sports at a high competitive level like that?
Well, I think that any athlete that chooses to go to that level has to understand of the risks involved, which unfortunately is not a deterrent for participation, but it can have some chronic issues later on that, can be fairly debilitating if not treated appropriately or undertreated. So, it's the evolution of injuries and its subsequent chronic problems is huge. It's unavoidable. Arthritis happens to everybody. The only way it doesn't happen is if you die.
Wow. So let's talk about jogging versus walking. All the readings that I'm saying now that walking is superior over, say, jogging. Is that for a certain age, or is that as a rule?
Well, I think that
for exercise,
there has to be some context to that statement. When you are talking about a category of a non-high level athlete, then walking can extend your life. 4 hours a week of walking, cumulatively, statistics have shown, can extend your life expectancy whenever that was supposed to be 2, 3, 4 years. And that is not a lot of sacrifice for that benefit down the line. Obviously, for cardio purposes, and a high performance athlete has a little different mindset and a different mantra, and they will obviously engage in running competitively to optimize their upcoming performance or whatever competitive situation they're in.
So, Doc, tell me about some of the popular injuries. You said ACL, right? Are there any elbow, tennis elbow?
Well, you obviously have a fundamental knowledge of sports injuries. The lower extremity is sort of where my home is. And unfortunately, some of the more common injuries that you have that are really underappreciated are ankle sprains, Achilles tendonitis, and plantar fasciitis. Now, not to get too technical, but the most common musculoskeletal injury that brings a person into an emergency or urgency room setting is an ankle sprain. Okay. My specialty is foot and ankle, even though I deal non-operatively with shoulders and elbows and knees. But I do trauma of those areas. And to be honest with you, it's the ankle sprains I see in the office every week, all the time. The problem that exists specifically with ankle sprains and what makes it so underappreciated is the fact that X-rays, which are the first diagnostic tool, are typically negative. So everyone involved, the physician, the patient, their family, all say, well, X-rays are fine. You didn't hurt anything.
Yeah.
Okay. We fall into that, specific conclusion, which can be far from the truth. In fact, one of my favorite talks that I've done over the years is ankle sprains, too easy to diagnose, which means that they are put off as to X-rays negative, rest ice elevation. Right. You should be okay. Minimal immobilization. And then, 4, 6, 8 weeks later, they have sequelae that have a negative impact and require anything from extensive rehab and, missed time and even surgery. So that's the thing that's concerned. Back in the day, traditionally, Achilles tendon ruptures, there was basically 25% missed. Because, again, it's in the back of the ankle.
Right.
Okay. There's varying levels of experience for that initial diagnosing physician, and they may deal with the front and not really think about it. And again, fall into x-rays negative. But Achilles tendon ruptures are significant. I mean, unless you have some very significant contraindications, I operate on all of them, particularly with the technology involved now. That's another injury akin to ACLs, like you had mentioned back in the day,
Right.
that's evolved to recovery time, and everything is significantly shorter. Minimal incision surgery is the most common way to deal with that. I've been operating on Achilles with small incisions for over 10, 12 years. And in fact, I don't cast any Achilles tendon injuries that
Really?
have been operated
Is
on.
that old school, or is that?
It used to be, I mean, and I'm old enough to know what old school was because I started in old school.
Yeah.
But you would treat it either operative or non-operatively, and sometimes a long leg cast,
Mhm.
and in a position where the foot and ankles pointed down, and you had to be on crutches for 6 to 8 weeks. Then it would go to a short cast
Yep.
and start putting it down. Now it's outpatient procedure, takes an hour, incisions about 1.5 inches. I weight bear patients in 3 weeks. We start therapy in 4 weeks, and in 6 months, you can at least start back running treadmill and those kind of things. When before it was a potential career ender.
So I've seen some bad tendon ruptures, and it rolls up like a ball onto the calf. Extremely painful. So let's talk about some common mistakes. So at our age, we have to play age appropriate sports, right?
Yes.
So my mind says you can still, being a college athlete, I can go out, but the body says differently. So some common mistakes of some injuries that you see at that age will be what?
Well, the number one issue with people that are, in their 40s and 50s, we call them weekend warriors.
Yeah.
Okay.
I'm like MVP on that.
Yeah. Well, I retired on that. Okay. I retired on that.
Injuries follow that.
Yeah. So that went away a while back. So with that whole mantra, it's like you said, the mind says that I can still do my thing and I can still participate at a level that is not exactly the same, but certainly close enough because you set your bar based on your history.
Exactly.
Okay. And so you try to go, perform within 10% of that. That's the mistake.
Yes.
That's not going to happen.
Okay.
And then you undertrain, there's a lot
important.
Yeah.
So in a men's basketball league of 60 and over, I still need to train. This is what you're saying.
100%.
Okay.
First
Just
of all,
don't show up, roll out the bed.
No,
and
you cannot do that because you are a injury waiting to happen. Okay, and actually, I played in college and then played in a over 50 league when I came down here.
Yeah,
and then it was 4 guys in 4 months that were 40 or under that ruptured their Achilles. And I said, God's telling me to stop. And that was it completely. Okay. It's just one, and Achilles tendon, regardless of the technology involved, it's still a long recovery.
Yeah.
Okay. So that is something that I see very common, but you have to readjust your mindset for a person who is a quote weekend warrior versus a person who, is their focus is the prowess of their athletic abilities. Like, I can get to this level because I put 3 or 4 hours in a day. You can't be a guy successful and a business person and then like dedicate 4 hours a week max to an activity where there's someone who is doing that in like half a day.
Gotcha.
Okay.
Right.
So the adjustment of the mindset is the thing that gets people in a middle age group in trouble.
So let's talk about technology.
Yes.
I was watching Star Trek the other day. Why can't we get a device that we can just like roll over the person? Why are we still using needles like we did in 1879?
First
I
of
hate
all,
needles.
First of all, you're watching Star Trek?
Yeah, Star Trek.
Okay, let's start there. That's a problem in and of itself. But let's move past that and talk a little bit about the technology that's involved. It's, the problem with that is that of your statement with regards to the quote magic wand phenomena is that these injuries, regardless of what part of the body they're in, they require their rehab. There's no shortcuts. Mm-hmm. People, we live in a shortcut society. We want to get from A to B and not do the work. When you are, whether it's recreational or higher level, you really can't afford to do it, to approach it like that. And we have the technology that's involved. Now there's injury prevention programs. There's, wearable technology like our watches and smart watches that let us know steps and things like that. Now there's AI-driven platforms that help analyze movement. I'm actually partnering with a company that does motion analysis. And how we've seen leads that are on people while they're running, yes. And then the data comes in and the software analyzes their movement. Well, now the people that I'm talking with have the ability to do that motion analysis on their phone.
Oh, wow.
By just putting on a video and without the leads, with all of that. And actually the technology has evolved to where we can assess pre-risk of rotator cuff, tennis elbow, ACLs, Achilles tendon injuries before it happens.
Wow.
To be able to say, because of your body mechanics when you throw, unless you change this or change that, you will be more likely to have a rotator cuff tear than a person who has made those adjustments or falls into another category. Technology's evolved to that level. Now we do prehab. Okay, that's before you get surgery or anything. Prehab is working out to optimize a success rate with surgery.
Yeah.
When you have an injury. So you actually start therapy before you have the procedure to give you a better result down the line. So those are the kind of things we're looking at. And of course, my baby is regenerative medicine. Okay.
Talk to me a little bit about that.
We can get into that.
That's not stem cell.
That is. So,
okay.
When, for me, it started about 8 years ago, where there's a certain market that's ever evolving that says, I don't want surgery. I want to do something like you said, a shot or, something we can do to help me recover. All right. So the reality is that the best treatment is not necessarily a steroid in a bottle. Okay. It's the cells that come from you. Okay.
Yeah, sure.
So regenerative medicine, the basis of that, or the broader category called ortho biologics, is basically the stimulation of your own regenerative properties for different injuries you have. To simplify things is the three ways that you can get stem cell, which is the best healing property that you can have, okay, when it comes from yourself. There's no process situation, there's no adverse reactions and things like that. You don't have to worry about any diseases that are transmitted from animals or whatever is being processed.
Yeah.
So it started, one of the things that started is taking placental fluid from young women, where they actually, the amniotic fluid from the baby's placenta is taken and processed and then re-injected. Now, that's not from you, okay? But that's sort of the initial treatment modality that helped foster this whole program of stimulating your own regenerative properties. Then there's PRP, okay, platelet-rich plasma. That's drawing your blood, spinning it in a centrifuge, separating it, okay, and then re-injecting the PRP, the platelet-rich plasma, back in your shoulder, your elbow, your knee for arthritis, tendonitis, rotator cuff problems, Achilles tendon, plantar fascia, the whole thing.
That's literally healing yourself from yourself.
Exactly.
Yeah.
And PRP has significant anti-inflammatory and regenerative properties. Now, the richest stem cell, which you talked about, is the wave. That's where everybody's, says stem cell, and can you use it for this and that? It's acquired a significant amount of sensationalism over the last 7-8 years, some good and some bad. There's these pop-up companies that basically state they're doing stem cell when it's really not. So it's caused federal regulations 2 or 3 times to say, look, stem cell falls into this category. Anything else cannot even be mentioned as stem cell. But that is like there from other than PRP, which has some stem, you can go literally to your back and your posterior pelvis area and numb it up under anesthesia while you're awake. Locally, stick a needle in, go to the right depth under ultrasound, draw off bone marrow aspirate, filter it, and then re-inject it. And that's rich in stem cells. And the younger you are, the more stem cells you have. The other way is that's getting a lot more popularity is you can get actually a significant amount of stem cell from fat and your love handles. Okay. So you basically are laying on your belly. You are, you numb the area, you go in,
lipo.
It's sort of like that technology, but you really inject a hydrolyzer and then you wait 15 minutes, you pull it out, you process it, you inject it back. Now, the problem with the whole orthobiologics in general for the common person is that insurances view it as still experimental, even though it's been on the market for 20 years, and they don't cover it. Okay, they don't cover PRP. They don't cover stem cell of any kind. They don't cover amniotics or any of those things. So what's our dilemma? So first of all, it's, when it first came out, it's only for those that can afford. But some people, when they look at everything in its entirety, say, look, I have a deductible, it's X amount of money.
Right.
All right. And even if I have a surgery, I'm going to still pay X amount. And there's complications involved. There's time off work. There's going under anesthesia and all those things to give people angst. And some people will say, look, if I get 75 to 80% improvement, then I'll pay $2,500 because I would have to pay that on my deductible anyway.
Anything to get out of pain.
That's right.
Just lightning in the bottle.
Exactly.
Yeah,
and so the whole time off work, all those things are mitigated with this. It's no real time down. You can resume activities, somewhere depending on what you're getting treated for in 3 to 6 weeks. Okay. And it has a 75 to 80% success rate as documented. In fact, I just went solo almost a year ago to the day.
Congratulations.
Thank you very much. And I'm looking at having a whole nother company that is just orthobiologics. That's a division of JFI Sports Medicine.
Now, what is JFI Sports Medicine?
It stands for Just Friends Involved.
Love it.
I've been blessed over the years to, even though I came down here, did not know one person, not one. Okay. But I've been blessed to, had some really great relationships, and I'm president of the largest Black medical society in the state.
Leroy Jefferson Foundation.
Yep. Leroy Jefferson Medical Society. It's 2 years in, and I just got reelected, and we're all about mentoring and, helping the underserved and underprivileged navigate through spaces that they may not be able to do on their own, particularly in healthcare. God put me on this earth for mentoring, improving function, and, taking care of those of need. I love dealing with kids. In fact, one of the most significant things that's happening in my life in a very short period of time, within the next 6 months, is a academy in Wellington called the Wellington Sports Academy being built.
Right.
It's one of the largest projects in the history of Palm Beach County, and I'm the medical director. So that's going to be a whole nother facet of taking care of kids and adults, and another arm of mentoring, and opportunities creating to give everyone, regardless of their socioeconomic status, a free shot, particularly in the athletic space.
Yes.
So that's going on right now. So this is a good time for me.
I'm excited about what you're talking about with the sports and with the different doctors. But let me ask you a question, because when we're playing ball and they have a physician on the sideline, you come back, you say, this is hurting. They always would say, oh yeah, you're okay. Get back in the game. Versus I very rarely saw, this is high school and college, they say, no, you can't go back in. They'll say to the head coach or whoever, the athletic director, he can't go back in. They will also always send him back in. Who's coaching them? Who's policing the police on people like that?
Well, I think that one of the things is, some of it is we're in a fairly litigious society now.
Yeah.
So some moves are made or not made based on the fact that you potentially could be putting said player at risk for further injury. So there is an inherent regulatory thought process involved with that. But things have evolved, like, the technology on the sidelines. You see players going in the tent. Okay.
Yes.
First of all, you have to respect HIPAA violation.
Yeah.
Okay. And you put them in the tent. But like, one of the things that we're going to have at the academy is a handheld fluoroscopy machine where we can literally in seconds diagnose if you have a fracture or not.
Nice.
So if you don't have a fracture, then it's basically a soft tissue injury. And then your only limitation of, quote, going back in, like you talked about, is how much pain can you handle?
Yeah. Not
really, is it going to
right?
jeopardize or, change a fracture that's in good alignment to a bad one? That can be addressed now with the new technology. That's just one small example of what exists. But that whole, Newt Rockney playing through, like playing through pain, that still occurs. But there are modalities that can quickly discern if there is a problem and to be able to evaluate the risks and that kind of thing. I mean, the best diagnostic tool we still have, despite all this technology, is your hands. Okay.
Now you got to explain that one now. Right?
Okay. Well, the fact of the matter is, when you are dealing in this space, and, one of the things that I really am proud of is when a person comes to my office, they're not going to be rushed.
Right.
I'm going to make them feel very comfortable. I'm not going to speak over their head. They're probably going to have to wait a little bit for me. Okay. But because I take my time when I'm in there with you.
Yes.
Okay. It's just you and I, and we're going to figure it out. You're going to know what my thoughts are. You're going to have a diagnosis, and you're going to know the subsequent treatment plan.
And you and I, because I've been to you,
Clearly.
you talk very plain.
Yes.
Where we can understand that.
Where we are.
What's going on.
Right. So, when you say, where does it hurt? And you point to an area, I can put my hands on you and let you know with a reasonable amount of probability if you have a fracture or not, okay, or is it a soft tissue injury? If there's ligament damage, forget the MRI. I don't need an MRI on some injuries. When you want further information, you order the MRI. But MRIs, to be honest with you, is probably one of the most abused diagnostic tools that exists. But the unfortunate part is we as a society are so educated that physicians are actually judged. Well, they didn't order you an MRI. He must be awful.
Yeah.
When we already know Achilles tendon ruptures is one of the few injuries we've talked about that a person can give me in history before I even put my hands on them. And I'm thinking more likely than not, it's Achilles tendon. It's somebody kicked me in the back of my leg, but no one was there.
Right.
Or I felt like a pop down there. That's Achilles tendon until it's proven otherwise.
Okay, I got you.
Okay, so, we still can't forget what brought us here.
Very good statement. Let me ask you about the miracle drug, CBD. What's going on with that? What are you up for it, down for it?
I mean, I'm a person who I do not think that science, Western civilization is exact.
Yeah.
I think that there's still a significant amount of things that God says it doesn't have an explanation. I don't care how educated I have made you. I don't, it doesn't matter. It's just some things you have what we call an unknown etiology. So I have embraced the fact that sometimes, and I hate it, but sometimes I have to leave you with, I don't know why that's happening. So if you respond to acupuncture or CBD and say, you know what, I feel okay with this. I can resume my activities. It still hurts, but I'm much better.
Yeah,
that's a win.
Okay, that's a win.
That's a win because when you came to me, you were complaining of pain. Nobody comes unless it's the last visit saying, I don't have any problems. I just wanted to come check you out.
Yeah.
Okay, they come for pain.
Right.
Yes.
Well, we're going to close. This is a leadership forum. Right. Obviously, everything that you're saying is tip of the spear. You're leading out front with JFI and with your company. How do you think your leadership skills will parlay over into your employees?
Well, the way I look at it is this. I finally felt, even though it's been over 30 years and I've still got a long way to go in my mind, that I still have a lot to give. What I will never sell anyone short on is me being knowledgeable about the latest and greatest in my field. So we can have a reasonable discussion about any of that. My challenge for the orthobiologics is to make it available to a lower income person, particularly an athlete, if we're speaking in the sports medicine space, versus a uber rich person that can afford to drop $5,000, $6,000, $7,000 at the drop of a hat for the same result.
Yeah.
I'm trying to bridge the gap.
Yeah.
I'm trying to create vehicles and mechanisms for everyone to benefit equally from what is out there. That's my vision.
That's Dr. Brian Coleman. It's a very powerful vision. And I think that we all can benefit for it in Palm Beach County. And we're very happy to have had him on today. Anything else, any closing remarks that you'd like to say?
I can't tell you how much I appreciate you and this opportunity. Obviously, we've met where you've been my mentor. And I'm so proud to even have the opportunity to help promote this vehicle, which I think is an insanely beautiful idea. So thank you for the opportunity.
Thank you. This show, Leadership Unlocked, this is what we're going to be doing in Palm Beach County. Many leaders in many fields. And again, until next time, be blessed.